Bladder pain syndrome was previously known as interstitial cystitis, and it is a condition whereby there's bladder pain or discomfort that is usually associated with a fair bit of urinary symptoms. Now, these urinary symptoms can include urinary urgency, where you feel an urgent need to go to the toilet to pass urine immediately; urinary frequency, where you feel like you need to run to the toilet very frequently to go and pass urine. Some people may have discomfort as the bladder fills or pain that's in the lower pelvis, and that actually relieves itself when you go to the toilet to void. Some women with bladder pain syndrome may also have a reduced bladder holding capacity. Now, if you suspect that you may have bladder pain syndrome, you should visit a urogynecologist because we may have to run some tests in order to diagnose you with this condition, and that may include urine tests to make sure there's no infections going on, or certain bladder scans or scopes to see whether there is truly a bladder pain syndrome. The exact cause is usually unknown, but from what we do know, it is related to a defect in the protective lining of the bladder. And that is supposed to protect your urinary bladder from the toxins that gather over here. So for those of you who have been diagnosed with bladder pain syndrome, then diet becomes a very, very important component in trying to manage these symptoms. Important food that you should try and avoid, and it's always very important to keep a food diary to see what kind of food groups kind of trigger your symptoms. But in general, foods to avoid will include things that contain caffeine, such as coffee, tea, or even alcohol, because that can serve to irritate your bladder further. Citrusy fruits such as oranges, tomatoes, coffee, as well as certain artificial sweeteners as well. All these can serve to trigger your symptoms and make your condition worse. So it's very important to look out for these when you're trying to manage your symptoms of bladder pain syndrome.